Good morning, everybody. My name is Leanne Wells. I'm the Chief Executive Officer of the Consumers Health Forum of Australia. What we're hosting today is a webinar. It forms the final session for the participating pairs in the recently run Collaborative Pairs Australia national program. And that's involved organisations from Headspace, or participating pairs from organisations that include Headspace, the Western New South Wales Primary Health Network, Coordinair Primary Health Network, and the Australian Digital Health Agency. The Consumers Health Forum of Australia, for those that don't know, we're the peak body, the national peak body for Australian healthcare consumer voices, and we are the overall national sponsoring organisation for Collaborative Pairs Australia. We decided to open up what is usually a closed forum for participating pairs as the final session in the program today to interested parties, including the sponsoring organisation for the pairs, but also other organisations that have shown an interest in Collaborative Pairs Australia. We're getting great interest in it, and that's very motivating and exciting for all of us. So it will be a slightly different format. It will give you a taster of what Collaborative Pairs Australia is all about, and it will be a slightly different fifth session experience for the participants to those that we've done in the past, just because we've brought in interested parties and stakeholders. And before we start with some of the other formalities, I'd like to first recognise the traditional custodians on whose land we live and work. And for me, I'm here in Canberra. We've got people from all around the country, but for me, that's the Ngunnawal people. I'd like to acknowledge their continuing connection to land, water and community, and pay my respects to their elders, past, present and emerging. I'd also like to introduce the facilitators that have led the Collaborative Pairs National Program. Jane Cockburn, she's the consumer facilitator, and Karen Patterson online as well. Welcome both of you as the clinician side of the lead facilitator pair. I'd also like to acknowledge, and this is really important because, you know, this program was a leap of faith for many of us, and I'd really like to acknowledge the 4 primary health networks that came on board with us 2 years ago now, or more than 2 years ago now. Western Sydney PHN, Western New South Wales PHN, Southwest Melbourne PHN and Northwest Melbourne PHN, who were original funders of the program, the National Demonstration Program. And I'd also really like to acknowledge the Australian Commission for Safety and Quality in Healthcare, who have supported us the whole way through investing in the national evaluation, both of this and the next stage development, stage 2 development, which I can talk about later. So just briefly, why Collaborative Pairs? Consumer CHF has an interest in finding innovative and systemic ways, I suppose, of how we can support consumers to act with impact and influence to drive change and influence the system and drive improvement as well. And there's a lot of consumer representative training available. Several organisations within our networks provide that. But we were looking for something that really took, consumer leadership and participation and involvement in the system, in policy and service redesign to the next level. We came across the King's Fund Collaborative Pairs program. And it really intrigued us because its point of difference, and you'll hear more about that today from the presenters, is that it involves a clinician and a consumer, hence the term pair, in joint learning and development and leadership and collaborative practice, with a focus on the relationship between the two and sharing power and all of those things which you'll hear about with much insight from our presenters today. And like I said, we have had some original funders. We've run several programs through those primary health networks. We've run a program now through Safer Care Victoria and this national program that you're going to hear about today. And the national evaluation is available and published on our website of the demonstration phase of collaborative pairs. It's certainly convinced us. It showed that we've got a proof of concept. It shows a clear need for a program like this in the Australian context, because that was always the issue. Does something from the UK and its point of difference in its health system translate and apply to our context? It certainly has done. We've demonstrated that. And the evaluation, most importantly, has given us some good ideas for improvement. So if you wanted to have a look at that, by all means do so. And I don't need to tell you, because you're all interested people. Obviously, the backdrop to all of this is, you know, developments here in our country like Standard 2 in our partners as patients as partners in care and our national quality standards, and the growing realisation, I think, and awareness from the literature, but generally for stakeholders in the health system, that consumers are the hidden assets in our health system and can really serve as agents of change if we support them right, work with them constructively, and work with them as peers, which is what this program is all about. So just on that note, just some really, really brief housekeeping things, and then over to the really exciting content for today. Just a reminder that this webinar is being recorded. We've disabled the chat because we've got around 70 people online, and we do have almost 70 people online, so that's fantastic interest. So we have disabled the chat, but what you can do as participants is use the Q&A function. So if you've got a question that you'd like to put to any of the presenters or Jane and Karen as the facilitators, as we go through, log them in the Q&A and we'll pick them up as we go along. What you can also do with the Q&A, and I'd encourage you to do this, it's one of the powerful things about it, is if there's a question there that you really want to see answered, you can vote on a question and it'll pop it up the queue, so to speak. So use that. And if there is available time at the end in the open Q&A session, in the participants list, if you go into that, you can use the raise your hand function if you wanted to ask an audio question. And Jane and Karen will be curating those as we go along. So that's enough from me by way of introduction. Welcome everybody, and over to Jane and Karen to lead the session today. Thank you.
Great. Thank you very much, Leanne. My name's Jane Coburn, and we'd just like, before we introduce all the pairs and they're going to share their experience, we'd like to introduce ourselves and also provide some key principles. So I'm just going to share my screen. So hopefully you can all see my screen, which we'll be using as we go through. But just Karen and I are going to take the opportunity to actually introduce each other. And I've been really fortunate to work with Karen for quite a while, actually since about 2013, before the collaborative pairs. And it's been in many guises. So how fortunate am I to work with such a highly qualified and experienced health service provider who has had many roles within the system. So she really has brought to our pair and the work that we do together such a strong ethical approach to high quality and safe care in many ways for everyone that uses the healthcare system and also within our communities and neighbourhoods. So as a pair, we're different and we're the same, which is always interesting. It's in many ways, and it can make our dance together really interesting, sometimes intriguing. For me, very much a learning relationship, but a strong relationship. And I think it's been so wonderful to model as a collaborative pair together and to come from these different perspectives. I really appreciate and I'm very grateful for Karen's thoughtfulness for others, which is always evident. And she has such a wonderful way with words, and that's why she's going second, so you remember that. Her bravery and her patience, her curiosity and her willingness to shake the tree. I love working beside someone who's got that, let's give it a go. So she's always focusing on best and better outcomes for all. So as a person with high standards and a big picture around wellness, Karen's really someone that I've enjoyed collaborating with in the Collaborative Pairs program, And together we're really change agents. So it's a real pleasure to be part of the Collaborative Pairs program. Over to you, Karen.
Thank you, Jane. Hi, everyone. I'm Karen. You know more about me now than I do. So what a beautiful introduction. So I'd like to introduce Jane Coburn, my collaborative pair. She's actually why I'm here. She sees the best in me and brings out the best in me. What I love about Jane is she's a fighter, a carer, she's conscientious, she loves to swim, she's an organiser, a scientist, an entrepreneur. She stares down power and she asks great questions. I value Jane's sense of humour, her willingness to give it a crack, and from the get-go, we have shared many laughs. I've walked beside Jane for many years, and I've had the privilege of being her friend when she was diagnosed with breast cancer and commenced treatment. You might have thought this might have made her vulnerable, but actually, she grew stronger. She actually rose to the challenge. She's taller than she was before. She harnessed her experiences and her life experiences and her talents and skills and started to focus her attention in being an advocate further for consumers, carers and families, bringing voices and ideas together with a focus on collective impact. She's an active member of consumer councils of the Chris O'Brien Lifehouse and the Central East Sydney PHN. But most of all, Jane gives me permission. Just be you, and then I can be me. It's a pleasure working with you, my peer Jane.
Thank you, Karen. And we wanted to provide a little bit of information about ourselves, because what we've really learned through working with the Collaborative Pairs program is it is really about self. One of the key principles is becoming really comfortable with yourself and your pair, and through that we can make change together. It's empathy-based and people-powered change. And we do that by asking great questions and working together and tapping into the things that perhaps are undercurrents or unsaid. And we do that because we know that as a learning community, we're going to inquire, test, and invite other people in to make great change. And that might be by providing a different focus, providing a different perspective, but always enjoying and inviting shared voice around what we do. Erin.
So this is an overview of the content of the program. You'll see that it's more of a weave than segments. And you'll see that the way we approach the program is that we integrate the principles that Jane talked about from the very beginning, from the get-go. So we start from a process of appreciative inquiry, where as individuals and pairs as a group, we co-design our learning architecture, how we want to work together, how we individually learn best, and how we can work as a group together. As we go through the process, we start to peel back the layers, and the arrows are going up, but they're actually going in. So through the process, it is about building safe relationships and safety together so we can explore ourselves and our power, how we behave and the actions of dialogue. We start to think about questions, exploring questions, utilising questions as ways to understand and to explore and to invite others to be part of our dialogue. Becoming an ecosystem, so moving away from a process whereby it's an ego and starting to think in regard to how we can learn and grow together. We can look outwards and we can look inwards. Reconnecting and building with our project. So on the other side there, you can see that we work together as a group, individually, as a pair, as a group. And then in between the workshops and our time together, the pairs apply that work to their area of focus. So it is about using the project or the system improvement or the shared interest as a sandpit to play in. So it's about giving people permission to, one, explore themselves and their relationship as a pair, and the other to apply that in the context of their question or their project as they start to go deeper into the question. So that's the the concept of the collaborative pairs. And I suppose one of the things we're really conscious of is that it can appear a bit abstract. It is a creative representation, what you'll be hearing today, as well as our pairs will be talking about what they've learnt. And as any great artist, if we're in real life, the guys would have been doing an interpretive dance for you. But we're going to do a bit of PowerPoint presentation instead. And so we want you to sit back and try and appreciate the power of what is going to be shared with you, but also recognise that we're inviting you into a dialogue. It's not just about today, it's about tomorrow and the next. And we would like you all to continue the conversation beyond this presentation today. So it's with great pleasure, our first presenters that we have today are Sarah and Matt.
Thank you very much, Jane and Karen. It's an absolute pleasure to be here, and it's been an awesome program to be a part of in terms of thinking about this way and learning really in this space and learning more and adapting our skills. So we might flick to the next slide if that's all right, Jane, and I'm going to hand it to Matt for him to introduce himself.
Hello, so I'm Matthew King as well, and thank you for having me here today. This whole program has been incredible. It's been such an awesome development to sort of better understand people and better understand how people react and engage with others. So it's been a very transformative program. And so the first slide is just about who we are. So we're both from Headspace National based in Melbourne. So I'm currently uni, but working on the Headspace National reference group. So, and then there's a big emphasis throughout this project that we've got on family inclusion in Headspace and trying to improve it and maximize it throughout. And yeah, I'm sure that Sarah's got more to say about her. So yeah.
So my name's Sarah Collett. I'm a Senior Family and Friends Clinical Advisor at Headspace National. So I'm sure probably lots of you have heard about Headspace. Headspace is a youth mental health service for 12 to 25-year-olds. And there's I think we're getting up to about 130 centres across Australia now, where young people can go for support, not just for mental health, but for everything and anything really. But we sit within Headspace National, so Headspace National is a bit different. It's kind of the national body that is there to support centres, really. So I'm part of a clinical team that really works both with our youth reference group, but we've also got a family and friends reference group, but also there to support centres in the work that they do. So that's part of us, and I'm really appreciative of everybody from Headspace National who's come along today as well, and also the wider community who are connected to all participants in this. So I'm going to flick over.
So our project essentially is, as we were talking, as I currently suggested beforehand, it's got a very big focus on family inclusion, and what Headspace has is to sort of maximise that family and friends inclusion is the family and friends reference group. And so what we wanted to do was sort of evaluate it and sort of see what areas need working on with the group and where it's currently working right now, throughout all the centres and amongst Headspace National, to sort of figure out what we need, how we can change the group and to actually help it maximise its engagement in the future. So we've currently did a survey on Google Forms to get everyone's feedback from past members, current members, and all different departments across the Headspace National network to get different opinions and also to see how they engage with the group and also what their understanding and their awarenesses of the group. So, and I'm sure Sarah's got more to say on that as well.
Absolutely. So I think the key here is we've got Headspace National has this really awesome youth reference group, which Matt's a part of. And we've also got a very small family and friends group. So I've just been employed in this family and friends specific role along with a colleague of mine. And what we wanted to do before we really revamped these family and friends reference group is really understand it, kind of understand what's going to be, what are both the members and National really want to see this group, and where can we utilise it where it's going to be really valued and important in the work we do, because we know family and friends are an important aspect of young people's lives. So that's kind of where we landed. Take it away, Jane, for the next slide.
Next one.
Yeah.
So at the start of this project, I kind of had literally no idea about what we were going into. To be honest, it was very much, I was asking myself who, what, where, why. I was very unsure about what we were going into, and also I was unsure about the project and the outcomes, like what we were going to get from the project. But we came with open minds, and we were really open to see what was going to happen from it. That it was very much, it got clarified a lot of what our understanding was and the scope of everything in our first session. So yeah.
Yeah, and I think I did owe that to Matt. When we came into this, I think it was, we didn't know each other. We were completely new to each other. And it was really unsure what on earth is this going to be about. But I think our focus was kind of, we've got this project that we've got to do together, and we've got to produce something, and what's that going to be like, and what's that going to mean? Which kind of, yep, you were right, Jane.
Does segue, yeah.
That was perfect. Which I might get Matt to explain a little bit more of kind of what it was like at the start for us.
So it was a very good segue into this slide. It was very much, well, the first session was it clarified our understanding, but we still weren't quite entirely, still had no idea what we were going to do as a project. And we were sort of doing all these different ideas. We sort of, like the whole tornado metaphor that I'll explain there, that we were very focused on the macro stuff, and we were overcomplicating everything. We weren't too sure what to do. We wanted to do something that was going to change everything, change the world, all that stuff. And we weren't entirely sure what was meaningful but also doable. It's like we couldn't quite get that balance. But what happened was, what we found was that the best solutions were the ones that was actually by focusing on the basic small things, which were needed to which could actually help incrementally create meaningful change over time.
Yeah. And it really was, our project was, when we got into this, it was Headspace is really on board with consumer advocacy and getting people involved in the process and really understanding and hearing voices. So we basically got paired together and said, do something around family inclusive practice. So we're like, oh my God, what, family inclusive practice, where do you go with that? Do we do something as simple as a fact sheet for clinicians or a clinical advisory service? Where on earth do we go with it? So it really was, who is Matt? Who are you? Who are we together? What is this program that we're doing? But also, what on earth in this massive scope can we actually do that is something meaningful? Okay.
Absolutely. And so obviously, we had quite a few contextual influences, like most of the world has been having in the last few months. So obviously with COVID, the whole way that we performed the project had completely changed. As from the start, we were initially going to go face to face once every week, catch up for a coffee. I forgot how we were actually going to do that still. That was, wow. Things have changed a lot since COVID. So that really it changed within a week from going face to face to instantly on Zoom. So having to deal with the sudden transition that was really overwhelming for everyone, going online, whilst also Sarah was changing roles within the Headspace network. And then also a lot of us had a lot of personal family things going on. So it kind of created a perfect storm, also adding to the tornado metaphor. And it was very everything was quite overwhelming, but it definitely influenced how we did our project and how we balanced everything out.
And yeah, I would just add to that, saying that, COVID moving online, kind of doing this project where you have to be partners with somebody, but then not being able to see them face to face, and even the group kind of dynamics and how we're going to manage that in terms of going online and being in this role, but also all the personal stuff that goes with the pandemic as well. So take it away, Jane, and we'll move forward in terms of what the program did for us.
And so the key tools that I can personally speak from is the ladder of inference was a big one for me, because it really changed how I actually ask questions and how I pursue asking people, getting their opinions on things. So, and it made me a lot more open-minded in doing the thing, because it got rid of my assumptions of, there's an issue that has to be fixed, and it's more focused on listening to what they have to say, because sometimes there may not actually be a problem at all. And we'll have a video later on which describes all of that. And also the World Cafe was really good in getting different ideas and really good for brainstorming. It was a really effective tool in getting different ideas and perspectives, which you would have not thought about at all. Yeah. And
so I think the key thing with these things, they're all kind of different tools to really shape the way you think about the work and how you approach the work. So the ladder of influence is kind of taking a step back and understanding somebody else's assumptions, and the World Cafe is kind of this way of getting people's ideas and input without kind of judging, but just listening and kind of gathering and pulling those ideas together. And for me, the action dialogue was big because it's thinking about my position in the conversations that I'm having in the work, both with people at national, but also the wider network, but also people like Matt and the reference groups that we're working with as well. Kind of thinking about the approach that I'm taking, the position that I'm taking, whether that's kind of jumping in there and listening, or whether it's kind of having a bit of conflict, but not kind of being able to have those conversations where you listen to each other, but also put your opinion out there is really important. And slowing down and taking a step back.
And also just adding on to that quickly, it was very good at like keeping things simple and going back to basics, because everyone is very frequent, like very common to overlook that. Yeah.
Which kind of leads us to this, which is kind of frames it all up for me in a way. So I'm going to get you to hit play, Jane. If you can. If it's going to work.
I didn't.
Oh, it's not going to work.
Sorry, I didn't realise it was a video. Let me.
That's all
It
right.
should work on the slide, or I can explain it if you like.
I can talk to it if you like, because I'm really aware of time as well. Basically, it's this video it's not about the nail. So this woman's got a nail in her head, and her partner's sitting there and she's kind of going, but it hurts and it's painful, and he's going, but you've got a nail in your head, rather than going, oh, that sounds really hard, and taking a step back. We can put a link up if we can and send it through so people can watch it. And I use this video across other things that I do as well, but I think it's that stop focusing on the outcome, stop focusing on what's kind of you think is the problem or right in front of you, and take a step back and really listen and do that deep listening and understanding and empathy and hearing what's going on underneath for other people and their perspective. Which I think this program really highlights, and it's really important. Next slide. Oh.
There's all this pressure. It's just...
My apologies.
We've all been there, it's all good.
Oh, God.
So this is pretty much how we've like transformed as a pair and also individually. So we've really come to understand the importance of listening to people and understanding like your own assumptions, but also other people's perspectives and their opinions, and also going slow and not rushing each process, because every part of going through like the collaborative pairs program has been, you need to go slow in order for it to succeed, and like, as they say, like slow and steady wins the race. And trusting the process at the end, that knowing that it will work out and you will get what you want as a result. And really the big thing that we took from it as well is we kept focusing on all the macro issues, the large scale, widespread stuff, but we sort of forgot to focus on the micro things, which are equally important. And so really going back to taking it slowly, understanding like the minor things, and they can actually be just as powerful. And there came out to the metaphor there with the rainbow, and yeah, everything got cleared up. Yeah, next slide.
Hang on.
Sorry.
Yeah, and I think the macro to the micro for me as well is seeing the parallels. When you take a step back, you see the parallels from a small family dynamic in this space where the young person and the family aren't listening to each other, to the service systems where families often get put to the side, to the bigger kind of wider healthcare system where families get put aside there, or the focus of funding and payment is on the individual rather than looking at the system as well and including consumers or including people into that process. And it kind of goes all the way up, as it did with our project in terms of the youth reference group is massive and it's awesome and it's really well engaged. And then we've got this tiny little family and friends reference group on the side that's kind of not really known about or not really thought about that much. So I think it's kind of seeing the parallels across that and building on the relationship is really important, and listening.
So our reflection, so I think Sarah, do you want to start with this one, Sarah?
Sure. I think it's just kind of a sum up slide to say how awesome it's been to get to know Matt and to have him in this process as well. I think his passion and his excitement and his get in there and just do it and give it a go, and perspective in terms of hearing both the young person's perspective that he brings, but also the sibling perspective that he brings, and the enthusiasm for the work. And it's been awesome just having somebody there to bounce all this stuff off, to challenge you a little bit every now and then, but also to do the work and know that he's got my back, or he'll pick up if something's going on for me. So it's kind of really building those relationships and having somebody there side by side, which is, I think, the power of this program as well.
Absolutely. And it's just the idea of like, we're in it together, and it's a collective effort, and you're not alone through it, and you don't have to it doesn't have to be just you who does have to do all the hard work. Like, it's an equal shared effort. So definitely. Yeah.
That's it.
Yeah.
Excellent. Thank you, Sarah and Matt, for kicking us off and being the first to present and sharing your reflections. So I'm just going to ask you to maybe just share with us in regard to some of your, what were some of the things that surprised you about when you were using the ladder of inference? You both identified that. What sort of assumptions did you discover or about using the ladder? Anything surprise you?
Do you mean like your personal assumptions that you kind of discovered?
Yeah.
My assumptions were kind of like, my personal assumptions was that the family reference group was like not working at all. That's what I personally assumed from the very start. And I think it was just, I really challenged it because there are areas where it is working well in some areas. And it was very much, it tested my assumption of the awareness of the group in the network as well. But it was just more about the presence and the understanding of it amongst the network. Yeah. How about you, Sarah?
I think for me, I'm a family therapist, so I've got the systemic ideas, and it really made me take a step back and kind of, I think I always apply it to everything, but actually taking a step back and applying it not just to the work that I do with families but to the organisation and to the project as well, and kind of hearing and listening to both the family and friends reference group participants and what they're getting out of it. But actually we need to understand what Headspace National are getting out of it as well, and their perspectives and what's happening in that system that these people aren't kind of being engaged or leaned on for the work that we're doing.
Because adding on to that, because if we understand the National's perspective, that's how we can better engage them in the network themselves to make it easier for them to work together. Yeah.
Excellent. Thank you both. Now I'm going to pass over to Jane.
Thanks, Karen, and thanks so much, Matt and Sarah. Sorry about that video, but we will pass around the link because I think it's really good for everyone to see. So our next pair that I'd like to introduce is Vicky and Mark, and they're in regional New South Wales, so from Dubbo and Orange. I'm going to share the screen again and hand it over to you guys. All yours.
Thanks, Jane. Hi, I'm Victoria Smith, Engagement and Digital Media Officer at Western New South Wales Primary Health Network. I wanted to start off by thanking Western New South Wales PHN for sponsoring Mark and myself to be part of the programme. The collaborative pairs really fits in well with our organisation's guiding principles, helping us to foster genuine consumer community, health professional and provider engagement. My interest in being involved in collaborative pairs comes from my love of working in stakeholder engagement. I've been involved in running a number of co-design projects in the past, and I was really interested in learning new ways of embedding this practice in my work. When I started at the PHN in November, my first project was to pick up the development of our consumer and community engagement framework. When I heard about the National Registration Programme of Collaborative Pairs, I thought it would be a great opportunity to combine the programme with looking at how we operationalised the framework so that it was developed in collaboration with a partner who had lived experience as a service user.
And good morning, I'm Mark Noble. I'm the consumer member of our particular pair, and some might say the oldest of the group members for this year's Collaborative Pairs program. I initially thought that all I was signing up for when I joined this program was a project. We could certainly say that the Karen and Jane show was a significant bonus to that. The training's given us new skills in communication, strategy, which while having challenges has been a great learning experience. It's elevated our understanding of this subject area to allow a new higher level of conscious dialogue, and in turn the development of an ongoing dialogue to produce the best outcome in our work. Back to you, Karen, Vic.
The project concept has developed quite a bit over the past couple of months. The initial idea was on operationalising the consumer and community engagement framework. However, it became clear from discussions with colleagues at the PHN that this piece of work could be much wider ranging in the organisation and take into account how Western New South Wales as an organisation engages with its stakeholders as a whole. So this would mean looking at our policies and procedures to make sure that they're supportive of involvement with consumers, and setting up a working group that looks at how we engage with consumers in what we do. So a reframed project plan was drawn up and submitted for approval. Alongside this work, Mark and I were attending the Collaborative Pairs training sessions. Personally for me, what stood out most was the use of tools like the World Cafe. This helped to work with others to bring new perspectives to your idea. And dialogue practices as well, which looks at the importance of how your voice works in a conversation, as well as the importance of listening, respecting, and stepping back from your own thoughts and perspectives. I feel these tools will be really useful when moving forward in setting up our project and developing a working group that is focused on the same goals. You can click on another one there, Jane.
And the next one, please. The Collaborative Pairs program introduces us to higher thinking and communication skills, the benefits of reflection, and a number of light bulb moments. Personally, the concepts that stood out most were the dialogue concept of groups and the ladder of inference. These are well-defined concepts that provide a measure of control and clarity into one's own contributions to a discussion. They are tools which enable clear pathways for interaction and discussion of the nature of the conversation taking place. The ladder of inference particularly gives us a way of monitoring our own thinking and contribution on the fly, and to consider where we and others are operating from in the course of a discussion. It will be very useful, I believe, in negotiating differences in conceptual understanding while they are taking. Next slide, please. But if you were to think that the learning ends there, you would be selling the program very, very short. This is an experiential program. It is learning in the most effective way. It is learning from modelling and participation. As a sponsoring organisation, you may think that this program is about people in a room with a project and some training, and they learn new skills. Pick that slide, please. To do this would leave your people still living in their own silos, their own cocoons. On the left of this slide is such a diagram which explains where the pair and the training and the project was sitting in my mind when we first kicked this off. The diagram on the right shows that when the pair and the training are appropriately integrated, you get R at that intersection. And it's R factor, the relationship in the pair, that creates the opportunity to work together and for that work to be greater than the sum of the parts. It's been a great opportunity and privilege to be exposed to this training, and I'm extremely grateful to the Western New South Wales PHN for this opportunity. And we as a pair wish to thank Karen and Jane for their great encouragement, incredible leadership and training skills, and it's been an absolute pleasure. Thank you.
Collaborative pairs has certainly also been a learning curve for me. Initially, my focus was directed solely towards the project and trying to see how I could authentically set up a meaningful project in such a short space of time. However, it became apparent that where I needed to be focusing my attention was using the tools to build a stronger relationship with the pair. And next slide there, Jane. So the next step for us will be moving into a more exciting phase of the project. Our pair will be setting up a working group comprised of consumers and staff that will help to shape the project and drive consumer involvement forward. Thanks very much.
Great. Thank you so much, Vicky and Mark, for such a lovely and meaningful presentation. Really enjoyed the metaphor that you were using with the butterfly, and I think that's a really beautiful way to look at your learnings and how you transformed and also came through the program. So a quick question for you. Wondered what you're excited about now, taking that next step forward, and what will you apply?
Well, the excitement is the inverse of the nervousness that comes with it. It's in some ways it's a wait and see process for me anyway. I'm coming very much from an advocacy and consultancy type basis. So being involved in a project such as this is a new direction for me and something I certainly look forward to. I think in our training, it's given me anyway the to be able to engage with the clinicians in the PHN and the executive staff to produce an outlook which will hopefully contribute well to the work that we'll be doing.
Thanks, Mark. Vicky?
Yeah, I'm really excited about this project. I think the past few months has given us a really good opportunity to bed down exactly what the project should be. And moving forward, I think having a group set up which is based of both consumers and staff members to look at the way that we embed lived experience in a day-to-day aspect of our work and making sure that it's embedded in each and every one of our projects and how we work and what we do. I just think it's such a great opportunity, and I think it's going to be great for the organisation as well.
Great. Thanks very much, guys.
And if I could just add a little more, please, Jane. Yep. What's really exciting for me, I think, is the opportunity to actually have some influence over the way in which the PHN and then health services in this vast region of Western New South Wales will be actually delivered and to see how we can produce programs and services which will actually really benefit the community from the consumer's perspective.
Great. Thanks so much, Mark. It's lovely to hear how it's going to be, you know, potentially applied through the work that you guys will be doing out in regional New South Wales. Karen.
Okay, so it's time to move on to our next pair of Kate and Dee. So Kate is in the hills of Victoria, is that correct, Kate? And Dee is, excuse me, on the central coast of New South Wales. So for our first, as Matt had identified there, we had a face-to-face session, and the intent was for the program to be all delivered face-to-face. Kate was unable to attend our first session, so she attended virtually with Dee, and then they've been virtual ever since. So it's been a really interesting experience about developing relationships from a virtual perspective, and gives me my great pleasure to hand over to Kate and Dee to share their reflections.
Thanks, Karen. Dee, would you like to introduce yourself first?
Okay, my name is Deirdre Elam. I'm a mum of 3, full-time carer for my daughter, who is 47 and has multiple disabilities. I also cared for my mother at home, then through the transitions into and during her nursing home experience. I'm a carer rep for New South Wales Health Intellectual Health Teams Advisory Committee, and also carer reference group for Carer Gateway Service Provider New South Wales 4. I was Carer of the Year in 2016, and my major love and mission is to be a great advocate for people with disabilities. I live up here on the Central Coast. We do have a regional, we don't get as much as what the city does, so it's important to have collaborative pairs around this area so we can start working as a whole.
Thanks, Dee. So yeah, I have a couple of kids and a partner and a dog, and we're all currently in lockdown in Melbourne. So I'm working at home and doing my job virtually as well at the moment. But I work in Bendigo Health as the Chief Nursing and Midwifery Information Officer. So my job is to lead nurses and midwives and ensure they've got the digital health skills to meet the current demands of contemporary healthcare. And boy, have we seen telehealth suddenly be the success of 2020. So yeah, well, I've worked as a patient liaison officer as well, and fundamentally believe that the only way that we can improve the quality and safety of healthcare is working in partnership with consumers. So that's the background for us. And we both work with the Australian Digital Health Agency, and we're very, very grateful to have been asked to participate in this collaborative pair. Over to you, Dee.
Next slide. This is me. So this is the day 1 of Collaborative Pairs program. We're about to learn that the way of thinking of them and us was about to change into a relationship of shared purpose, mutuality, co-ownership, and shared decision-making. Kate and I dreamed and envisioned our best environment for encouraging creativity, thoughts, ideas is in nature. And the tree idea grew from our shared enjoyment of that nature. The tree also was a symbol of being grounded with its roots, always growing with its leafy canopy, and the branches for widening our ideas and principles and values. The path that encircled us is a mutual respect as a clinician and as a consumer. It was a challenge for me, as I was the only one without a partner in the room, as we've already noted that Kate was in Melbourne. So, but luckily Kate and I had prior conversations and had already made that personal connection. But who knew that we were making inroads with virtual collaboration and preparation for what was to come, and that the entire program would move to Zoom and digital. Next slide.
Thanks, Dee. So yeah, I was on that phone that Dee was talking into, and yeah, getting into the space of virtual care, well, virtual Zoom meetings and collaboration has it's also unfolded, and I think our skills are really good. I think, Dee.
Yes.
So we were handed a collaborative question in the initial communication we had with our colleagues at the Australian Digital Health Agency, and really it centres around how we can use My Health Record to provide some glue to improve continuity of care, collaboration, respectful and authentic relationships between consumers and clinicians. And we both think that you can tell from our previous experience that we think high quality aged care is actually an exercise in high quality collaboration. So we've seen, I think, the critical need for sharing the right information, health information at the right time across the system, which we know is subject to fragmentation, and there are gaps and there are access issues. And we also know from our own experiences that sometimes the consumer involvement has been a bit tokenistic, and we think that work is worthwhile if it's undertaken with the consumer being involved from the outset. There's often gaps. It's not easy, but understanding timelines and potentially the dissonance with that. There is often situations where there's urgency for carers and people living with health conditions and health problems that isn't shared by the clinical world. And we tend to sort of silo and compartmentalise problems, and we're involved, I guess, in the business of prioritising lived experience over stats and data, but we know that data is so important, I think, in meeting the challenges that we face. So we basically had from the outset this idea that we're going to come up with a neat and tidy package of back to Australian Digital Health Agency of this is what our pair has found and this is what you should do next, and that unravelled very quickly when we got into the deep work, I guess, of what a collaboration is. All right, so next slide, please. Great. So understanding of what we know about our healthcare system, and I think it's an excellent one. I really do. I'm watching the pandemic unfold and our healthcare response. And very proud of my colleagues and everyone trying to do the right thing, but we know that there are some problems in our system, and we ascribe, I guess, to the nothing about me without me principle, and the collaborative pair, and how our thinking has changed has really come to focus on this idea that we can be optimistic, that the problems can be solved if we work together. And we think successful collaboration is really contingent on fair and strong representation from the people who have the authority to speak. Next slide, please.
Thanks, Kate. Now, this was a crazy panic. Oh my God, what have we got ourselves in for, and how can we sort out all the systemic problems of aged care? It was a big breath moments and head in hands and thinking, oh, woe is us. But, some of the things were, how does digital health help improve aged care, the experience of aged care? What is better aged lives? What is better? How do we decide what data and information to collect to inform our project? Such as what age group do we really have to look into? How do we know that we're on the right track with our inquiry and information gathering? We began to make several assumptions. Assumptions, will we get enough to progress? Assumption that we will not be able to educate the elderly in digital health. Then our thinking began to evolve, our aha moments. And like the other participants in these groups, could you change slide, please? We also found that the ladder of inference was probably one of the the better or the best tools that to begin with. It gave us a beginning of the rest of the tools and knew that we were going to keep learning and learning and learning. Up until this moment, we thought, what is Jane and Karen doing to us? You know, like, where is it all leading? But the ladder of inference came in that most people do start with assumptions. The ladder enabled and opened up pathways into our problem, the aha moments of confidence in making better decisions. I learned how to look for information, look for data, look outside and think, are we heading in the right direction? With a new sense of reasoning, a wider field of data and more considered assumptions, you can now work up the rungs of that ladder. It has become a technique that I've used in everyday life. By following the principles of the ladder, I'm a better decision maker. As with my own at-home lifestyle, I have to train staff for my daughter, and I was making incredible assumptions when people walk through the door, rather than taking that breath, waiting, having a look at the knowledge or the data that they could maybe bring in, and not jump to conclusions. So by following the principles of the ladder, I became that better decision maker. Create space, creates opportunities to allow situations to unfold. This tool has supported arrival at a more confident understanding. It allows a more thorough process and conclusion. Kate, you want to add?
Yeah, I just really like that the ladder has really been a feature of all of the pairs. I'm impressed. I know we're going with the tree symbol. Enjoyed the butterfly symbolism, but yeah, the ladder is a feature because it's just been a really great way to think differently about things. Next slide, please. So the other sort of great aha moment for me really was about this mindset shift. So thinking differently about things. I think you really have to work hard to innovate and initiate change in a system as complex as our healthcare system. And I think we've all seen how great we do in a crisis. We can move rapidly, but I think what we've realised in the collaborative pairs is that you really need good foundations. So good earth to grow your trees in, and we need the people power. People are really important. So the tools and the techniques that we have explored have given us some ways of looking differently at old problems, and to better understand the constraints that obviously do exist in the collaborative enterprise, time and bureaucracies and potentially cultural issues. And I think just on this slide, I wanted to just share with you that when we got to this point in the program, suddenly something sort of extraordinary happened. Suddenly we began being linked in with other collaborations and collaborative efforts, and we got this cascade of invitations to do some work in aged care, and that's been quite amazing. So and I'll talk a little bit more about that with the next slide, but just this understanding that our healthcare system is kind of set up to be transactional, and we've learned that we can add, I guess, a human experience layer and a compassionate layer as well. And care is important. So the Australian Digital Health Agency, for me, is an exemplar of collaboration, and Dee and I have really, again, I mentioned before that we've been very appreciative of being brought into some of the work that's already underway. So Fiona Martin, Rebecca Jolly, Vanessa Skiba have been key contacts, and we think we would love to use some of the tools that we've already been exposed to in this sort of future work. So looking at opportunities for aged care consumers and their carers to collaborate with the work that is happening at Australian Digital Health Agency to inform improvements, so that My Health Record can be used more effectively. And, you know, that speaks to the glue that we spoke of before about using digital health tools to improve healthcare. There's work underway with specialists, doctors, and, you know, potentially nurse practitioners too. So working with those groups in private practice and the people that support the aged care sector to use My Health Record. And we're also involved in a project led by Dr. Ruth D'Souza at RMIT, and Ruth received an RMIT Vice Chancellor's Fellowship this year and is based in the School of Art and is looking at physical distancing, social isolation and telehealth in culturally and linguistically diverse older adult communities. So people living at home alone together in a time of COVID. So we've been invited to collaborate with her and her team on that project. Next slide. So this is really the grand learning for us, that we can share the work that we've got going on, and the work is actually easier when we have a collaborative partnership and we follow some principles of collaboration. So this beautiful idea about building constellations rather than focusing on lone stars. We think that working in partnership creates for a better human experience, and definitely it's been a source of empathy and kindness and all the things that we know are really important in achieving a good quality healthcare system. Dee.
Yeah, well, it's to work collaboratively, is to tap into many voices in a positive way. As a consumer, it's not we do sometimes a very totalistic, or we feel like we're very tokenistic, and it's not about just only being listened to, but what does it mean to be heard. Working collaboratively makes us stronger. There is great energy to be tapped, and rather than walking a single path, now we walk a shared path, and that's what collaboration brings to us as Kate and myself. It was great learnings. It was, and I think we can only go further and further ahead, and to make that constellation even bigger.
Thank you.
Thank you. Thank you.
Thank you, Kate and Dee, for sharing your reflections and your challenges along your journey. My question I've got for you both is just a quick question, which is around, I know that developing your relationship virtually, you've made some special times together. Can you share just a little bit about how you created space to build that relationship over time?
We had a rolling connection. So using every device we have, text message, phone calls, Zooms. We haven't done carrier pigeon yet, have we, Dee? But it's on the list. Yeah. So, but just understanding, sort of going along with a sensitivity, I guess, and support for the stuff that was unfolding in our lives as well.
And we were so very much like-minded, so it was so terribly easy to become friends, you know. And we were only talking the other day if we were closer, because even we're in two different states, but even if we were next door, we do truly believe that we would now be friends. You know, it was just one of those relationships that it was just it brought us together. There was never any difficulty in it. We had the same values. We had the same, when we certainly do want the same outcomes. So it was a terribly easy relationship and partnership right from the word go.
Beautiful. Thank you, guys. I'm going to pass over to Jane.
Great, thanks so much, guys. I now have the privilege of introducing our final pair. Last but definitely not least. So I'd like to introduce Carrie and Belinda. So we're now moving to the south coast of New South Wales, that beautiful country. And so we've another move into another geographical area, but certainly collaborative practice takes place. So over to you guys. Let me just get you back up.
Great, thank you. Thanks, Jane, for that introduction. And I'd really like to thank all of our guests who've come along today, and in particular, thank members of our PHN coordinator for their sponsorship and for bringing Carrie and I together. Next slide, please, Jane. So we thought we'd begin a little bit by telling you about us and how it was that we were brought together and why we were brought together. So my name is Belinda Thews. I'm a clinical psychologist and I run a small private practice in Moruya on the New South Wales south coast. I primarily work with people with cancer and chronic disease, and I guess it was on the surface my interest in chronic diseases, which was why I was chosen and selected to be brought together with Carrie. But I guess like Carrie, I was also very much a convert to the collaborative way of working before this program, and I have worked as a support group leader for people with cancer. I've worked closely with peer workers in my roles in community mental health, and I've also had the privilege of working closely with consumer representatives in academic roles that I've had in the past in research projects. So I was already really switched on to this way of working. Over to you, Carrie.
Thanks, Belinda, and hi to everyone, and welcome to this what's very exciting showcase presentation for all of us. So I'm a lived experience advocate working in mental health and suicide prevention systems reform, and I'm living in Wollongong in New South Wales, and I'm a consumer member of the PHN's Community Advisory Committee, and I'm also a lived experience member of the Illawarra Shoalhaven Suicide Prevention Collaborative, which is really taking a ground up whole of community collective impact approach to reducing suicide in the region. And I think that's probably one of the reasons that I was chosen for this PAIRS program, certainly my background in consumer advocacy, but also that I'd been really passionately committed to developing my skills in the collaborative way of working.
Next slide, please, Jane. Okay, so the problem that we were asked to think about and address when we came into this project was broadly around the issue of chronic disease management in our region. We know from work that's been done by our PHN that there's a very high prevalence of chronic disease and rising risk in the southern New South Wales local health districts, and people with chronic diseases and rising risk often have high numbers of preventable hospital admissions and high healthcare costs. They also have high health literacy needs. And we know that there is a very poor coordination of care and lack of affordable services and prevention programs for this patient group in our region. We also know that there's a lack of understanding of the needs and challenges that are faced by people with chronic diseases amongst health professionals, and also a lack of services impacts negatively on people's mental health and physical well-being. And it's also been well documented that there's a lack of peer support initiatives for people with chronic disease in our region. Next slide, please. So what we were hoping, and what we've been working on and trying to achieve through our collaborative PAIRS project has been to try and increase consumer participation in the co-design of chronic disease self-management initiatives. And we want to really try and leverage this collaborative PAIRS way of working into future co-design projects in our region. And we've also developed and presented for the PHN a co-design project plan which will increase social linkage and improve self-management for people with chronic diseases in our area. Next slide, please.
And so I guess at the heart of this, as you would have already seen, is the collaborative PAIRS is all about moving towards consumer empowerment. And so we use the IAP2 public participation spectrum as a kind of a guide for ourselves. I think some people would be familiar with this, to really sort of map what we're doing in terms of levels of consumer engagement and public engagement throughout the process of developing this project. And while we could see that the collaborative PAIRS was obviously an exemplar of moving towards the empowerment end of the spectrum, it also emerged to us that the PHN, so coordinator, it's really aligned with their commitment, and it's certainly a strategic priority to increase the active and meaningful participation of consumers in their initiatives. And then it also just really, really maps to our own personal values around developing equal partnerships for change initiatives. Thanks, Jane.
So we'd like to share with you not so much about our project, but particularly what we've learnt as a pair through the Collaborative Pairs program and this way of working. Next slide, please.
Thanks. So I think you've already heard this. I mean, a lot of us have really starting to draw out these common themes, but just the value of listening in order to build relationships as a sort of the starting point and the end point and the middle point for the Collaborative Pairs program, and just for this way of working, I guess. And I think we started out as well, and I think other pairs have also spoken about this, really very goal directed. I remember our first session, we were like trying to get a grip on like, how is this going to relate to being able to produce a proposal. We were very, very goal directed, and we really had to slow down and take a step back and develop some patience and understand that just sitting in the process of building relationships, that process is the outcome. And I think that's one of the very transformative sort of mindset shifts that's been facilitated by the program, and is so valuable and continues to be valuable. I think it's a lifelong process, and I know already Belinda and I have both seen the value of that in terms of our professional roles, but also just how much it's impacted the way we do things personally as well. So yeah, just the key is about that deep listening with a genuine curiosity, and that requires really letting go of ego and the need to control in order to build trust. Thanks, Jane.
Yeah, and like the other pairs have already mentioned, we learnt a lot about the power of frameworks in shaping strategic thinking about old healthcare problems. We learnt frameworks that helped us to understand how to really listen and understand assumptions. We also learned about models to really ask important and powerful framing questions to try and understand our problem, and learned about frameworks which helped us to understand discourse and conflict management and power sharing in the conversations that we were having. Next slide, please.
Yeah, and we really started to really see the value of how complementary skill sets and experiences, rather than further kind of instantiating that us and them kind of dynamic that often happens when people have different forms of expertise, that actually when you combine them, when you take the time to build those relationships, those equal partnerships, you do tend to find more creative solutions to traditional problems. I was very aware that research shows that through genuine collaboration in terms of health services, systems improvement, that, and particularly in co-design, because I've been involved in facilitating a number of co-design processes, that you tend to get some really cool, very novel solutions to complex problems, and that the research shows that when you do follow the principles of genuine collaboration, that you will get more effective and sustainable services that really do meet the needs and wants of communities. But what's been so fantastic about this program is to be able to really see what that means in practice rather than just theory. Thanks, Jane.
The other thing we did in this program was have a lot of fun. And we learnt that in order to collaborate successfully, we really need to be willing to experiment, to have fun, to be creative and let go of ego. And this slide here shows us all, we learnt a lot of warm-up exercises, and this was one of my favourites, an improvisation exercise called Yes Let's, and it shows us dancing like John Travolta, giving ourselves hugs, having good belly laughs, and I think even being teapots. Next slide, please.
So this is us as otters, because I think otters are a really great example of the collaborative way of working. They wrap themselves in kelp and hold hands so they can take turns having a nap when they're floating down a river. So that's a pretty cool example of collaboration. And I guess what it showed us, the program in the end, that it wasn't just a matter of combining our skills, but it was actually about the fact that we are greater than the sum of our parts. And I think finding that out might be a dangerous thing because we've become extremely ambitious about changing the system together. Thanks, Jane.
Great. And I really wanted to share also some of my personal experiences of being in this program. I feel very lucky and privileged to have been brought together with Carrie, who she's taught me so much, and I've learnt so much through her about both the art and science of peer workforce and co-design. And I think it's fair to say that we've developed both a friendship and professional collaboration, which will, I'm sure, endure well beyond this program. I also feel really personally very privileged to have met Jane and Karen and all the other members of this collaborative pairs group. I think it's true to say that every single one of you are forward thinkers and change makers, and there's been a real dynamic energy about being brought together with a group of people like all of you. I think it's fair to say that in the world of mental health, the past 6 months have been extremely tough, particularly down here on the New South Wales South Coast, where we've had some terrible bushfires this year. And this program has really filled my cup with energy and enthusiasm. It's given me a lot of confidence, and it's encouraged me to continue to lean in so that I can work for health service improvement in this area. And I just wanted to say thanks again to our sponsors for letting us have the privilege of being part of this program. Over to you, Carrie.
Thanks, Belinda. Yeah, look, it's been nothing short of transformative for me. People are telling me all around the place that what is this collaborative pairs program? I feel like a champion of it everywhere I go. I find it just an amazing opportunity to learn about the collaborative way of working, but to learn so much about myself. I've really had to deeply critically reflect on myself, and that's changed my relationships personally as well as professionally. And also, because this is all about relationships, the best thing is that I found a friend and an ally in Belinda. I know that we're going to keep working together. We're really committed to making sure that all this beautiful momentum that we've gathered isn't lost. And we are so grateful to Jane and Karen and to the other group members, just how inspiring it is to see people working in different places, in different contexts. But there's such a shared common humanity here, which is so meaningful. And it's something that I think we'll carry with us. And I guess we would also just really like to thank specifically Coordinator, who's so generously supported us, and particularly to the CEO, Diane Kitcher, who's here today. Thank you very, very much. And also to Jo Risk, who's Director of Consumer Participation with the PHN. She brought us together. I think we now know there was a method in her madness. We weren't quite sure of what the program is or why we were brought together. But thank you so much. We are so grateful, and we are very, very committed to spreading this way of working in our region to improve services for the local community. So thanks.
Thank you so much, Carrie and Belinda, for sharing that. It was really lovely to hear your learnings and your insights. So I just have one very quick question for you both. Perhaps just, share, for each of you to share one key thing that you think you will now apply to your project from the collaborative pairs. Belinda, did you want to go first?
Sure. I think the thing that I've really learnt is to slow down and listen, and to spend a lot more time on the groundwork before getting to the solution. I think one of the learnings that I had, and I saw it reflected in other health professionals that were brought into the program, was that we are in our work so outcome driven. And I saw that myself and all of the health professionals and were really focused on, okay, so what's the job to be done and when can we deliver it? But the program has really taught me to stop and slow down and listen, and to make to put a lot more focus on the process rather than the outcome.
Thanks.
Carrie?
I can second that. That's exactly the thing that I was going to say. It's so that process is outcome, and I see that with the collaborative that I'm a part of down in the region. So I thought that I had that in my back pocket, and I realised how much work I've got, how much learning I have to do, and this is a lifelong process to really, really double down on getting curious and as a mentor of mine says, to just really hunker down and listen, particularly when you think you know the answer. So I'm very grateful for getting a much deeper kind of skills-based knowledge around that.
Thanks very much, guys. And I think for all of us, whenever we think of you, we'll think of those otters holding hands as they go up the river, which has been a beautiful visual and metaphor that you've brought to us. So thank you. I'm just going to hand it back now to Leanne, and also for Karen and I to wrap it up, just to let you know that we will be showing a short little video at the end. And Carrie has creatively communicated the collaborative pairs message, and it really draws on everyone's insights and experience. So I just wanted to let you know that, so that you hold on to the end and experience it. So over to you, Leanne.
Thanks, Jane, and thanks so much for all your presentations. What you've really seen today is a microcosm of the sorts of pairings and the sorts of projects and learnings that we've had across the 4 PHNs, and also in the Safer Care Victoria implementation as well. So I hope, and I certainly did for me, reinforce again for me that all your presentations enormously varied, both the learnings varied, the practical application and the projects you brought to serve as your anchor project for your learning are enormously variable. But I think that just serves to show the wide application of this program, and the change and the learning that can come from collaborative practice. So I suppose my reflection too on your presentations is that it not only pairs consumers and clinicians, but we had some nice phraseology in there about the extent to which the program pairs practice and theory. There's a little bit of theory peppered through there, but the focus is on practice. And I also like the phrase art and science. It brings those two concepts together. Because, you know, it's probably more on the art side, isn't it? You know, art and in how we work together, because it is all about relationships, and there's no textbook for those. But equally, we can learn a lot and continue to build on those learnings and applying those learnings in terms of how consumers and clinicians can work with each other's skill sets and transfer knowledge and capture knowledge together and apply that. So congratulations again. Thanks for your participation, and also for you guys, thanks for the long haul with this one too, because you all had to shift gears, didn't you, into a very much a digital mode of delivery, which in itself, from our perspective, was fantastic, because one of the things shifting now into where CHF is going to be going with the program and our next stage development thinking with it is how do we, in our broad geography of Australia, continue and sustain this program in a way that makes it sustainable, makes it feasible and cost effective to deliver, but in a way that doesn't disrupt the integrity of the program, the integrity of the way our facilitator team, Jane, Karen and others in other states have delivered it, and keeps the integrity of the King's Fund design as well. So I mentioned our national evaluation before. Proof of concept we've got, we'll be bringing in some of the learnings and knowledge capture from your experience, the Safer Care program that we're evaluating as well, into a bit of a stage 2 development thinking phase now. And, you know, obviously in conjunction with our partners, the facilitators, other expert advisors, a component of that is going to be working with one of our I think Andrew Harvey's online. Thanks Andrew for your ongoing support from Western New South Wales PHN. So one element of our next stage development is going to be continuing our national demonstration of this really, and looking at, and I think we've got some good evidence today that it can be delivered virtually, looking at how we can deliver it in a virtual mode, particularly so it's available as a program to rural and regional Australia and not something that's confined to urban settings as well. So we'll be doing that with Western New South Wales PHN. We'll be evaluating that as well with the support of the Australian Commission on Safety and Quality in Healthcare. So it's not ending here. We are moving into a very active phase of next stage 2 development. And we're enormously proud of the program, proud of all of you, absolutely proud of all our facilitators. We were so amazingly lucky to attract the calibre of Jane and Karen and the other facilitators that we've had working in other programs in other states to the program. And I'd also like to acknowledge Jenny Parham. Jenny's online as well. Jenny's been the project lead, doing much of the behind the scenes work with Collaborative Pairs as project manager and coordinator here at CHF. So on that note, thanks again. It's been very inspiring for a Friday morning. Sets us off into the weekend on a nice footing, I think. And back to you, Jane and Karen.
Oh, thank you, Leanne. Greatly appreciated. And it's been a pleasure working with CHF and you and Jenny, and obviously working with our pairs from here. So we're going to be closing up with a video, and I'd like to acknowledge the questions that people have through the Q&A process. And we'd like to, obviously, any other questions from there, we'd be happy for those to be forwarded to CHF and they would be forwarded on to us. One of the things that came out from the reflections today was that what I encourage you to do is let this all sit with you. There's no rush. Feel and notice what bubbles up with you, both throughout the day, the evening, and as time goes on. Try and listen inwards and feel outwards. Connect with others in different ways. And our challenge for you is thinking about what you'd like to take from what you've heard today, what actions that you will put in place within your own relationships, and what challenges you will take on in your future journey from joining us as Collaborative Pairs and building on from there. So I'll pass over to Jane for our big wrap.
Thanks.
Jane, could I perhaps say one more thing? Sorry, it'll only take a second. I just really encourage you as pairs, and maybe as a get together, and think about putting in an abstract for the Shifting Gears Consumer Leadership and Experience Summit that CHF's running in Sydney next year, late March. Details are on our website, but the call for abstracts is open now. You can think about a panel or a workshop, mini workshop, or all sorts of abstracts in all sorts of forms are possible. So to continue showcasing and to continue putting the spotlight on collaborative practice, just wanted to draw that to your attention.
Thanks, Leanne, and thank you, Karen, for weaving those wonderful words and to leave something, a gift with everyone that's joined us today. We really appreciate that you've joined us and you've been part of the showcase and all the wonderful learnings from the wonderful people that we've had so much joy working with as we lead through the program and build the energy on collaborative practice. I also ask you that you think about now that when you're working on your projects with these wonderful people and the other people that are helping you out, to think it as a pair, invite them both in, so that where normally you may not, but I know with Karen and I, we come as a pair now, and that's how we make sure that everyone's perspective is there and our strength is together, where we can support and build upon each other and be those change agents. So I guess that's my ask for you. We're leaving you with so many asks, but thank you very much. And we're going to go out, as I mentioned, on a video that Carrie has put together, to show her wonderful creativity, which we have experienced through the program. And it really does show the highlights and the insights of everyone that's been involved in this program. So all the 8 people, the 4 pairs. Of course, we had Matt and Sarah, we have Dee and Kate, we have Vicky and Mark, and Carrie and Belinda. So here's our parting gesture to you all, and thank you very much. And that's a wrap. Thank you so much, guys. Karen, were you up dancing?
I was dancing.
Thank you so much. Please reach out to us if you have any other questions. As Karen mentioned, we'd be happy to forward them on. And thank you very much to Consumer Health Forum and Leanne and Jenny, of course, who's behind the scenes, but there, and it wouldn't be possible without you all. Thank you.